Good. Okay, so I'm going to take you through a series of exercises to help people who have tight glutes and limited internal rotation. So the external rotators can be very tight in the hips. So what we're going to do is we're going to do self-myofascial release on the gluteals, particularly in the area of the external rotators and what's known as the piriformis. Okay, so what we're going to do is use the foam roller. So I'm going to roll down the foam roller so that it sits on the higher glute, specifically directly between my femoral head and my PSIS. So that, I'm going to drop down to my elbow. And then the next movement, once I feel that I'm in that right spot, I'm going to move forward and backwards ever so slightly, and I can feel a little groove, and there's the foam roller. So from this position, I'm going to draw the knee in towards my chest and just start mobilizing the tissue that's under that area. So I'm just going to draw it in. I'm going to start lubricating and actually try it in different directions. So I'm going to clam my leg open and close my leg. Good. A few times. Good. And again, different range of motion, maybe 8 to 10 movements per each. And then finally, I'm going to drag my knee and internally rotate my hips so that my other heel comes up onto the other leg. Okay, if this is really difficult for you to do, you're going to continue to work with the previous motions that were discussed. So then when you get it here, this is what you're aiming for. Okay, so pull, internally rotate, place the heel up on the thigh. Try not to have to move the thigh to do so. That's a series of events you're going to move through for self-myofascial release. Usually 8 to 10 of each of those movements. The second piece of this puzzle is then to do active isolated flexibility. So I really like the stability ball for this. You're going to put your heel up on the ball, okay, opposite to the leg that you're working on. So if I'm working on my left leg, which I have been, what I'm going to do now is two things. One, this knee, I want to actively abduct and internally rotate. So from this position, boom, okay, I'm going to draw my heel towards my butt, and that's going to stretch this muscle. So what I want to avoid is my knee coming towards my chest. I need to keep the knee pushing away from my body. Leg goes out. Leg comes in, and this creates a stretch for the external rotators of the hip. Keep my hip levels flat, keep my PSIS flat on the ground. Inhale, exhale on the way in and out, nice and smooth. Again, somewhere between 15 to 20 repetitions. I would switch sides appropriately, move over to the other side to do so. And then last but not least, we're going to get up into a position where we start driving range of motion through the whole body. So I refer to these as windshield wipers. Lock the shoulders down and back, open the stance in the legs, and then hold that position and drop the knee down towards the floor. You notice if I'm in hip flexion, what I want to do is open my legs a little farther so that my hip is in an extended or neutral position here. Open the shoulders still, go to the other side, and go down. Now if people have great range of motion, they should be able to sit taller. Initially you're going to sit back, eventually you're going to sit taller. The taller you are, the more difficult this is for range of motion through the hip socket. So the taller you are, the more difficult it's going to be. Over time, once you get good, eventually you can release your hands off the floor, hold this tall position, keep your torso facing forward, and drop your knee into the ground. Your objective is to push the knee all the way into the floor while holding an upright position with as little body motion as possible. You'll notice my left side did not go into the ground as easily as my right. If that's the case, make sure you double up the repetitions. For any of these, if it's harder on one side, or you lack flexibility on one side, or the exercise feels more difficult on one side, double the number of repetitions to that side. Double the amount of repetitions of the knee pulls to the chest and all the SMR exercises as well. That's your tip of the day to help for glute flexibility.